Hi everyone, we're back. And the topic for discussion today, again, we're talking about the new nurse, Nursing Fundamentals, page 3, because this is 3 of 4. And the topics for discussion are aortic rupture, cardiac tamponade, pulmonary embolism, deep vein thrombosis, disseminated intravascular coagulation, DIC, and of course shock, some types of shock like hypovolemic, cardiogenic, and septic. So let's get started. Let's take aortic rupture, something you probably don't hear about that much, but never know if you're ever going to find yourself in the position of taking care of a patient if possible. Trauma to the chest may cause this problem, aortic rupture. The aorta, as we know, is a very large blood vessel which has very high pressure. And indeed what happens, if it should happen that there is a trauma, it may rupture. And unfortunately, it can be overlooked at the trauma scene. One can be suspicious if a patient has been in a collision at high speed and possibly not wearing a seat belt. Some of the symptoms you would expect to find would be shortness of breath, chest or upper back pain, and hoarseness or difficulty speaking. And I wanted to talk about cardiac tamponade, which is something we very often don't see, but I was witness to a patient who was having an ultrasound down, and at that time it was detected. A pericardiocentesis is usually done, which is a long needle that is put into pericardial sac and withdrawing that extra blood and stuff which compresses the sac. And then we have Beck's Triad, which is unique to that kind of situation with the distending neck veins and so. Now pulmonary embolus. Pulmonary embolism is the result of a clot breaking free from the foot or leg and migrating to the lungs. Other causes could be things like fractures, obesity, trauma, cardiac problems, and plaque buildup in the blood vessels. A patient who's confined to bed, unfortunately, is at risk for deep vein thrombosis. Sluggish circulation in the legs, patient not moving their legs a lot can lead to it. And remember, typically what happens, TED hose and SCDs are very, very helpful in encouraging patients to move their legs in bed. And there are other methods that I use. I've seen where patients have some of those little machines that they use to do passive range of motion, very helpful. But the important thing is to encourage them to do that leg movement so the stagnant circulation does not wind up with nothing but blood clots traveling to the lungs and causing more problems. And so we're going to go on to hypovolemic shock. This is very important, and we have sessions 9 is it's also on YouTube, hypovolemic shock, and sessions 10 is cardiogenic shock. Now, hypovolemic shock, if you ever worked in the emergency room, you might be witness to seeing a patient right after they've had a trauma come in. And typically what you get is like decreased oxygenation, a decrease in blood pressure, rapid respirations, rapid heart rate, cool, clammy skin, decreased level of consciousness. It may be at the actual trauma scene that you witness this. And of course, usually what happens, the nurse does her assessment, the doctor is the one who orders all the lab work, he does his own evaluation and decides what treatment is necessary. Typically, these patients need IV fluids to replace circulating volume, to bring the blood pressure up and sometimes blood transfusion may have to be ordered depending on how critical the situation is. Other causes of hypovolemic shock could be excessive vomiting, diarrhea, or diuretic therapy. Sometimes dehydrates patients. The complications such as ARDS, adult respiratory distress syndrome, I'm not going to go into it, but if you go to dearnurses.net, the clinical setting step by step, it's packed with helpful information on ARDS. Now we're going to talk very briefly about septic shock. And septic shock can, if it gets into the cold phase, a very poor prognosis. Typically what happens is there are two phases, the warm phase and the cold phase. What causes it? Well, it usually is invasion of the body by bacteria such as gram-negative, and there might be other ones, but that's supposed to be the main cause. What would you expect? Well, what causes it? After abdominal surgery, lung or urinary tract infections, traumas, or some kind of general surgery. I've seen patients, go septic. High fevers, they get very ill. In the warm phase, when they have, tachycardia and flushing and increased respirations, their WBCs are high, and then it goes to the cold phase when everything flips. An their decrease in mental status, hypotension. And if you ever had the opportunity to see a pulmonary artery catheter, some of the readings there can detect what happens with when a patient is in a septic shock. So I hope that you've learned something from this. I know this has been quite quick, but if you would take the trouble to go to dearnurses.org, dearnurses.com, and dearnurses.net, there's all kinds of helpful information there for you on these topics. There are videos, there is an open book at dearnurses.net, and there's just open articles all over dearnurses.org. Have a great weekend.